I'm Dr. Becky Lynn. Thanks for joining in with me, ladies. I'm excited to be back on my YouTube channel. Please remember to subscribe, like, share with your friends, because today I'm talking about the sexual changes that happen when you have breast cancer. I'm an obstetrician gynecologist and I specialize in sexual problems in women, and I'm also a breast cancer survivor. So I hear what you're saying, ladies. I understand what you're going through. There's so many changes that happen when you have breast cancer. But basically, when you're first diagnosed with breast cancer, it's all about getting treatment. You see this doctor, you see that doctor, you have surgery, you maybe have chemo, maybe have radiation, and all of your focus is on getting better and beating cancer. And the problem is, typically part of the treatment for breast cancer is suppressing your hormones, blocking your estrogen, or taking your estrogen levels to the lowest level possible. And so if you're not in the menopause, it'll throw you into a menopause. And if you are in the menopause, it can make your symptoms worse. After all your main treatment is done, in some women, not in all breast cancer patients, but in some women, we put you on other medicines that you stay on, like tamoxifen or aromasin. And these are medicines that block estrogen or prevent estrogen from being made. And they really put you in a very postmenopausal state. So what happens then? When your hormones are blocked or not there anymore, the vagina gets very thin and dry. It becomes like a piece of 8x10 paper. You can poke a hole in it. Sex hurts. And the way we many times treat vaginal dryness is with vaginal hormones. But when you've had breast cancer, estrogen is the scariest thing around. And I totally get that. Hormones kind of got you into this mess in the first place. So most women with breast cancer want to avoid estrogen at all costs. The other things that can happen when you have breast cancer is, let's say you had a lumpectomy or you had a mastectomy where they take off a breast. A unilateral mastectomy means they took off one. A bilateral mastectomy means you had surgery to remove both breasts. And we think about that and we say, that's great, we're getting rid of it. All they did was cause me trouble anyway. But the problem is that you don't realize that even if you have reconstruction and you have breasts, you feel disfigured. Many times they'll remove the nipples also, and the nipples are a very important sexual organ. And we never learn about that when we're going through all the cancer treatment. Nobody really talks to women about the fact that they're not going to have the same sensation in their breasts. And many women really miss that. Many times for breast cancer treatment, your doctor will recommend that you have your ovaries removed or a hysterectomy where they take your uterus out. And so if you think about it, a woman with breast cancer may now have gone through chemo, no hair, no breasts, no ovaries, no uterus, and you might say, what is left of me that's woman? But there's plenty. You still have a vagina, you still have a clitoris, and you can still have a good sex life. It's just about finding your new normal. And I know many people hate the term new normal. I personally love it because it just tells you that you don't have to give it up. You just have to find a different way to work through your breast cancer. So if you're not happy with your chest, you don't like your reconstruction or your scars, or you didn't get reconstruction and you're embarrassed, cover it up. Buy something sexy, put some lingerie, do something to make yourself feel good. Other things you can do, I'm going to go back to the vaginal dryness now, is use lubricants. Definitely use lubricants and have sex, because just having sex helps the vagina from getting more dry and more thin. Because when you have sex and when you orgasm, you bring blood flow to the vagina, which brings nerve growth to the vagina. So the vagina is a use it or lose it. Don't be scared, because if you can't use it, if you don't have a partner, you can always use a dilator or a vibrator or something to maintain vaginal health. You can also use moisturizers. So there are plenty of vaginal moisturizers on the market. Just go to Amazon.com. But I really think that the best vaginal moisturizer is Crisco. Yes, I know it sounds crazy. It's what we fry chicken in, but it works very well as a moisturizer in the vagina. And so does coconut oil. It's kind of got the same consistency. You can use as much or as little Crisco as you want. You can, put some in your hand, put it in the vagina, put it on the outside. The opening of the vagina, the bottom part towards your bottom, is called the introitus, and that's the most sensitive spot. So you might just want to put a little bit of Crisco in that spot just to keep that tissue moist, because dryness is awful and it makes sex hurt. And if sex hurts, you're not going to want to do it. You're going to have more trouble with orgasm. You're not going to get aroused or engorged. So you want to choose a vaginal lubricant or a vaginal moisturizer. Some women with breast cancer decide that it's a quality of life issue and they decide to use vaginal hormones. And these are things that you can discuss the risks and benefits with your physician. I have somewhat of a paradigm that I use, and not all oncologists or other gynecologists would agree with me on these, but you sort of have to weigh the risks and benefits. Some women with breast cancer choose to use a vaginal estrogen. And when you use a vaginal, local, in the vagina, low-dose hormone, low-dose estrogen, it's very different from swallowing a pill or putting on a patch. When you swallow a pill or put on a patch of estrogen, we know that if you have an estrogen-dependent cancer, meaning that estrogen can stimulate the cancer to grow, then that can increase your risk of recurrence. So we never recommend that you use estrogen if your tumor had that area on it that responds to estrogen. But low-dose vaginal estrogen hasn't been shown to increase the risk of recurrence, which means cancer comes back. So, but theoretically it could, a little bit is absorbed, but it hasn't been proven in scientific studies. The American College of OBGYN says that if you've tried everything else, then you can consider using vaginal estrogen, but you always want to try the non-hormonal things first. There is another medicine out there that's called Intrarosa, and it is vaginal progesterone, which is DHEA, and it gets converted to estrogens and androgens in the vagina. It keeps the serum steroid levels in the normal post-menopausal range. It hasn't been tested in breast cancer patients. Nobody really tries these things in big studies on breast cancer patients. But I am comforted by the fact that the levels of hormones in your blood never get much higher than the postmenopausal range. As far as a contraindication, if you read the package insert of estrogen, it says you should never use it in breast cancer. And if you read the package insert of Intrarosa, it's sort of a precaution because it does get converted to estrogen, so you have to keep that in mind. There are a couple studies out there that looked at vaginal testosterone in women who are on aromatase inhibitors, which are like aromasin, letrozole, those ones that are AIs. So if you've heard your doctor talk about an AI, that's what I'm talking about. There's only a few small studies, so it really hasn't been studied in depth in breast cancer patients. But if you use a compounded intravaginal testosterone cream, the medicine that you're on prevents testosterone from getting converted to estrogen. So testosterone and estrogen are brother and sister. They kind of get converted one to the other, with an enzyme called aromatase. And aromatase inhibitors like aromasin or letrozole, and there are a couple others, block that enzyme. So if your body sees testosterone, it doesn't get converted to estrogen. But I am not an oncologist, but my understanding is that some tumors have testosterone receptors. Testosterone is what we call an androgen. So all of these intravaginal local treatments that are hormonal. You know, not everything is known when it comes to breast cancer. So that's why you have to really weigh the risks and the benefits. Another thing that happens to women with breast cancer is sometimes they lose their sex drive. And usually it's due to a variety of things. It's due to now you've got a chronic illness. You might be depressed. You might be anxious. You might have pain. And if you have pain when you have sex, you're not going to want to have sex. Also, when they take your ovaries out, your ovaries were the organ that makes testosterone, which is one of the things that controls sex drive in your brain. Because a lot of sex drive comes from up here. Your brain is your biggest sex organ, ladies. So what can you do about that? There's a couple things you can do about that are non-hormonal. There is a medicine that is called Addyi that is out there, has not been tested in breast cancer patients. Like I said, that's hard to find, but it's not a hormone. And Addyi is FDA approved for premenopausal women with what we call hypoactive sexual desire disorder, or low sex drive. That's not due to something else. Like, it can't be due to a problem with the relationship or a really mean partner or somebody who doesn't, someone you don't really like that much anyway. But if you have low sex drive, you can use Addyi off-label. And it's a medicine that you take every night because it makes you drowsy, it makes you sleepy. So, if you have trouble sleeping, which is super common in menopause, it might be a good thing. It works in about 50% of patients, and it takes 6 to 8 weeks before you see an effect. The FDA recommends that you do not drink alcohol when you take Addyi, although I know there are studies out there that are being done looking at if there's really a danger with the alcohol, but I suspect the FDA will keep that warning on the Addyi. They recommend you not drink not one drop of alcohol. But it is one non-hormonal way to improve sex drive, and it works through dopamine and serotonin in your brain. So anyway, if you have a great idea for a new name for new normal, since I know some breast cancer survivors love it, some really don't like that new normal at all, let me know. I'm looking for some catchy, different phrase that means the same as new normal. So leave me a comment. But the good news is, if you're a breast cancer survivor, you do not have to give up sex. Sex is important. Intimacy is important. Just human touch is important. And you might think, well, I can't use hormones, so forget it. There's nothing that I can do. But the good news is, there are plenty of things you can do. And I didn't even mention half of them. So thank you for tuning in today. Subscribe, share, leave me comments, leave me questions, and I will do my best to answer them. So all of you ladies and gentlemen out there, have a good night. Bye-bye.